Hi, greetings from Yale New Haven Hospital and Yale University. My name is Pramod Mistry. I've been a member of the Gaucher community for many years now, since I was an intern, and Gaucher disease is a major focus of our work here at Yale University. Today, we are going to be talking about biomarkers and why your doctors take a blood sample to check your biomarkers to see how you're doing. And I think a good point to start is to ask yourself, those of you who have suffered from massively enlarged spleen, have you ever wondered how much of this bad lipid that builds up in my body is in the spleen? Many of you think that the whole of the spleen is full of lipid. You'll be surprised to know that in fact it is only about 2% of the weight of the spleen. And that has made many doctors and researchers wonder for a long time, what is it that this Gaucher lipid, glucosylceramide, glucose, fatty acid, and ceramide, it's a complicated lipid molecule, is doing to the body that leads to disease manifestations. I know that some of you are here who really haven't had much in the way of enlarged spleen or even low blood counts, but you have had devastating bone disease with chronic bone pain, bone crisis, and need for hip replacement. Have you wondered why that is happening? And so these are some of the central questions that researchers like myself and others have been addressing at Yale for the past 10 years. And so in the early days, the way we assessed Gaucher disease was by measuring how big the liver and the spleen were, or checking the level of the blood counts. Some of you know that your liver and spleen is not all that big, and some of you may even have your blood counts that are completely normal. And yet, you are suffering a lot from bone disease. And so how do you try and identify a marker of the disease that allows your doctors and you to know, is your disease getting worse or is it getting better with treatment? Or if you're on treatment, are you having the right type of treatment? And these are very, very important questions. So we need a marker of Gaucher disease in the blood that tells us what is the body burden of these fat-filled cells that are causing all the disease symptoms. And so that quest to discover a marker, much like as diabetics use blood sugar checking the control of their diabetes, that quest for Gaucher disease to find a similar marker in a blood test began 20 years ago. And the biggest breakthrough came at University of Amsterdam in Netherlands by a group that was headed by Professor Hans Arts, who is a renowned scientist in the field. And what he did was he took Gaucher cells, which are fat-filled cells, isolated from the spleen of people who had their spleens removed, and started to analyze what substances these cells were producing. And he discovered that chitotriosidase, it's a protein that was produced thousands of times greater than normal cells. And that over time has become a marker of Gaucher disease. And I'm sure all of you know what your chitotriosidase is. And you are following it much as a diabetic would be checking and keeping a list of your blood sugar measurements. But there are major limitations in chitotriosidase because we have learned that 5% of human populations, whether you have Gaucher disease or not, just don't make chitotriosidase. And that means that chitotriosidase, while it is helpful as a biomarker, it is not essential for you to develop Gaucher disease. And so there has been a long quest to find a biomarker that allows us to measure the activity of the disease and a substance that we can directly relate to how big the liver is, or how big the spleen is, or the bone effects. And so we stumbled on this about 8 years ago when we were working on our mouse model, and we started to understand what were the mechanisms of Gaucher disease. So the first thing we learned was that the Gaucher lipids were markedly increased, as we expect. And the second thing we learned is that these mice, much like patients with Gaucher disease, had a lot of inflammation. Their immune system was activated. And we found that the main lipid that accumulates in Gaucher disease, called glucosylceramide, was converted by cells into a lipid called glucosylsphingosine. Some folks call it Lyso-Gyl1. We coined that term. Others call it Lyso-GB1. So you may have different terminologies that you have become familiar in your clinics. And so we went on to try and understand what this Lyso-Gyl1 does to the body. And we learned that Lyso-GB1 or Lyso-Gyl1 is actually an antigen. What do we mean by an antigen? Imagine how you feel when you have a flu infection. There is a flu virus in your body, and your immune system is recognizing flu virus proteins, and your immune system is activating many different types of immune cells, and that gives you joint pains, you feel tired, achy, headaches. Some people even run a fever. That's what happens when an antigen is stimulating your immune system. And we generally think about antigens in the form of infections, viruses or bacteria when people have pneumonia. It turns out that this Lyso-Gyl1, this chemical substance that builds up in Gaucher disease, acts like an antigen. And so it stimulates a particular type of immune cells called T lymphocytes. And we've gone on to determine what particular subset of these T lymphocytes are stimulated. And these cells then in turn stimulate B lymphocytes to make antibodies. And so it's almost as if your body is constantly inflamed, that it's almost behaving as if there is a continuous infection of some sort. We went on to show that this Lyso-Gyl1 is in fact a very potent a molecule to damage bone. It causes osteoporosis and even lower blood counts. And in those people who are unfortunate to have Parkinson's disease, when it accumulates in the brain, it can lead to Parkinson's disease. And more recently, we have gone on to show that this Lyso-Gyl1 is what drives multiple myeloma in the small number of individuals who develop this complication. So Lyso-Gyl1 has now become a biomarker that we can track in the clinic. Those of you who are not receiving treatment, we can monitor its level, and if it is going up, then this is something that we would consider in context of all other investigations to start treatment or continue to monitor you. Conversely, those of you who are on treatment, this is a very exquisite marker to fine-tune your treatment and to see if you are meeting the treatment goals. And so Lyso-Gyl1 has truly opened the window into Gaucher disease in a way that, that previous markers have not. And so I think my take-home message to you today is that we have an exciting new tool. It is a simple blood test that can give us, open a window into how Gaucher disease is affecting you, not just in the liver or the spleen, but as a whole. in your bones and other organs of the body. And it has truly, in my opinion, I think it has transformed the way we think about Gaucher disease and also how we manage and take care of patients and monitor treatment. So with that, again, I want to thank the National Gaucher Foundation and for all of you to take the time to come and listen to my presentation. Thank you.